Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we'll be continuing with our glucose transporters. So let's quickly have a recap of what we have covered in the first part. So we spoke about the glucose transporters and we broadly categorized them into the secondary active transport as well as the facilitated diffusion. So in case of the secondary active transport, this is nothing but the sodium glucose. So this is nothing but the sodium glucose co-transporter. So we spoke about under the secondary active transport, we spoke about the SGLT. So it was considered 1 and 2. Both serve the same purpose, that is the absorption of glucose. Next, we spoke about where it is present. So one was present in the small intestine as well as the renal tubules. Next, when we spoke about second, it was only present in the renal tubules. Then we spoke about the GLUT1. The GLUT1 is the function being the basal glucose uptake. So it was the basal glucose uptake. And we saw the major site of expression, that is the placenta, blood-brain barrier, the brain, the red cells, the kidney and the colon and other organs. Next, when you're looking at 2, this was seen in, continuing with 2, it is in the beta cell glucose sensor. And this is the transport of out of the intestinal and the renal epithelial cells. So this is a transport out of the intestinal as well as the renal epithelial cells. So transport out of the intestinal and the renal epithelial cells. So where was this main site of expression? So expression here is nothing but it is in the beta cells of the islets. So beta cell of the islets. Then comes the liver as well as the epithelial cells of small intestine. And also the kidneys. So beta cell of islets in the liver, epithelial cells, small intestine and the kidneys. Next we look at the GLUT3. The GLUT3 again the basal glucose uptake and it is present in the BPK, that is the brain, the placenta and the kidneys and also the other organs. Next, moving on to type 4. The type 4 is, it includes the insulin. So this is insulin stimulated glucose uptake and the parts include, there is the skeletal muscles, next the cardiac muscles as well as the adipose tissue. So adipose tissue, the skeletal muscles and the cardiac muscle. Then looking at the grade, the GLUT5. The GLUT5 is known for the fructose transport, so F transport, and this is present in JS. JS stands for it, the major site being the jejunum as well as it is seen in the sperm. Then moving on to the GLUT6. So what is special about GLUT6? The GLUT6, it is, the function is still unclear and it is present in the BSL. So what is BSL? It's for brain, spleen and the leukocytes. And this is for not small intestine, it is the spleen, and B for the brain. Lastly, we also look at, there is another one, that is GLUT7. So GLUT7 is for the G6P transporter and this is present in the ER, that is the endoplasmic reticulum, and the major site being the liver. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.